This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
We are back with Debra Hodgen. Excited to have her here as a biodynamic craniosacral therapist at her own wellness studio. Debra Hodgen Wellness is the name of the company, and hailing from beautiful Carlsbad, California, she's here to help so many people with craniosacral therapy, which if you don't know about it, she'll give us a little refresher. Also, she's a yoga teacher. She's going to fill you in and also introduce us to a very special guest today. So welcome back, Debra. How are you?
Thank you. Doing great.
Great.
I've talked a little bit about the basics of craniosacral therapy, what it is and why it works, how it works. And everything in the body is connected to the nervous system.
Okay.
And in craniosacral therapy, we tune into that with a very light touch on the body and help it connect and move and whatever it needs to do to feel better. Now, the one thing I wanted to mention today is how effective is it for people? And a lot of it depends on how open the client is. If the client is a little resistive, or maybe someone told them they need craniosacral and they came, but they're not really invested in it, their process may not be quite as good as someone who's very gung-ho for biodynamic work. The other thing is sometimes, especially if somebody's been through a lot of trauma in their lives, they do a thing which we call leave the body. So they can be on the table and we're holding space for them, but we don't feel anything. And that's because they've sort of learned to check out, maybe move away from the body. And in that case, I would start to just quiz them and say, well, how is your shoulder feeling right now, or something, just to bring them back. So that's another thing that we often find to get. And then some people feel very tired after a session, and they'll say, why do I feel so tired? And I'll say, well, it may be fatigue, or it may be relaxing and de-stressing, which you may not have felt a lot lately. So that's just a little bit about craniosacral. And then the one other thing I want to mention is every Monday at noon Pacific time, I do a chair yoga class. Most of it's seated, but some of it is standing.
Okay.
And you're welcome to check in with Shanti Kitty Yoga and come join us. So there's the two things. And now I want to introduce my friend Lalita. We met years ago, and I believe we met because you were my yoga student. Is that correct?
Yes,
true.
I was going to ask.
And,
Oh, amazing.
yeah, and she's an amazing healer. So I'll let her introduce herself. She'll let you know what she does, where she does it, and talk today about a specific aspect of it.
Great.
Lalita.
So thank you, Debra, for the wonderful intro. And thank you, Jill. It's so nice to meet you. And this is my
Ditto.
first podcast ever.
Well, congrats.
So,
I'm excited to be a part of it. Thank you.
Oh, me too. Me too. So my name is Lalita, and I'm a doctor of acupuncture and Chinese medicine.
Wow.
And I graduated from acupuncture college in 1998. And I've had a clinic in the town I live in here, Oceanside, California, since the year 2000. And actually, I had two clinics for 21 years. And post-COVID, we moved everything into one clinic, which is now a collaborative under my umbrella. And there's myself, another acupuncturist, 4 massage therapists, and 2 Reiki healers.
Wow.
So that's a little insight to my world currently. And if I thought today, if it's all right with you, and you just give me a timeout if I go too long, is I wanted to talk about my current passion, which is facial acupuncture for cosmetic enhancement.
Ooh,
And
yes.
a
We want to
year
hear about
ago,
this.
thank you. A year ago, I finished a very extensive 8 month training in that specific area. And you may wonder, well, why, after being in, having a successful practice, are you going to shift gears? Well, I am turning 70 this year, and
Oh,
I
beautiful.
don't want to go into my 70s using Botox or fillers or even getting plastic surgery. That's not really a road I want to go down. And in my studies, when I discovered that girls at the age of 16 to 18 are already getting Botox, my heart hurt. And I thought, can I possibly influence younger women, women at any stage in their life, and men? I have male clients to maybe not go down that road. So that is something I offer now. And let's see, I'm going to see if there's already a question. Or shall I just keep
Go
going?
ahead, go ahead. No, I'm okay.
I have a question. How is the facial acupuncture and therapy different from regular
Oh, beautiful question. So, when a patient comes in for their first acupuncture treatment, we do a very thorough intake. And I'm looking for, what is their list? Okay, right shoulder pain, left knee pain, fatigue, overwhelm, stress, working mom, going to school. And then I do a body treatment that starts with the ears, with the sympathetic nervous system. So the first thing I do is I have them breathe some essential oils in a specific breathing pattern to start to relax their sympathetic nervous system. And then I put in specific acupuncture points to also counterbalance the effects of being in fight, flight, or freeze, which many of us stay in for many reasons.
Yeah.
And then from there, I do their body points. I make sure they're comfortable on the table. I leave the room. I set a timer for 30 or 40 minutes. I come back in, take out the needles, answer any questions, and see them next week. So, how is that different from facial acupuncture? Facial acupuncture, they do an intake, but my first question is, what do you love about your face? And that usually kind of throws people off. They're not used to being
Yeah.
asked that question. And often it's their eyes or their skin. Um, One woman, it was her freckles, and they were so precious. So the next question then is, where would you like to see improvement? And the 100% answer in women 50 and above is their jowls. They look in the mirror and they see their mother
Wow.
and or their father, because it's jowls and eyes are beginning to hood.
Ditto. Yep, I agree. Same here.
Right? Right. It's like,
Uh,
oh, you look in the mirror and you're like, oh, hi, mom. Hi, dad.
uh-huh.
So so then from there we start the process. Okay, it's very different. Here I start with the same opening, lavender and essential oils and 3 breath works to first calm them down. Then I take a warm towel and I stretch their neck up and I stretch their neck back, and I have them now relaxed. But what is the thought behind that?
Mm-mm.
Well, I'm opening up the lymph nodes behind the neck. What does lymph do? Well, when lymph gathers, it makes a puffiness around your face. And people don't want that.
Mm-hmm.
So, then I move on to I actually cleanse their face just like an esthetician with beautiful products, all organic. And then we start, I do a facial massage, including buccal massage. So I always tell them, when you hear me put on the gloves, I'm going inside your mouth. Now, that may sound weird, but just yesterday, you get your thumb and your fingers in someone's mouth and you pull and release that buccal muscle or the masseter muscle that has been holding on tight since birth. And my gosh, so what does it do to the face? Well, when a tight muscle is relaxed, everything bounces up. So it's a lot about releasing the muscles, knowing the muscles, what they're doing and why. Why is the platysma band pulling down? Why is the depressor muscle making us look like a sad face? Why do we have these 11 marks? Well, that's the corrugator. So then I actually do body points, usually 4, just to release stress and calm the sympathetic nervous system. Then I put, let me backtrack. I'm going fast. I then take a simple gua sha tool and I do their entire scalp. You think, well, why is she doing my scalp? Well, all that tightness, no blood is flowing. Mind is dull. Our hair is falling out. Well, I get in there with my 69-year-old hands and I work that tissue. And everyone actually loves it. Because when's the last time someone reached up to your scalp and rubbed it and made it feel alive? Okay, so from there, I then take my gua sha tools and this is a rose quartz one. And I start here and I start moving the lymph out. The lymph system is like a garbage disposal. You have to empty the garbage disposal first
Okay.
and empty the termini, and then you start draining, draining, draining. So we don't start up here with the lymph. We don't start back here. We start at the heart center and go all the way under the armpits. So then I do more facial stuff where I'm lifting this platysma muscle, which if you've ever put your head back in yoga and moved your jaw up, it's like that whole thing is so tight, right? From there, I use facial cupping and I do the same thing. I take the cup and I just move it along. And then I come up to the jaw, the sternocleidomastoidus. I
Okay.
use a smaller cup and do this. For you guys, I was going to do my cheeks because with just 2
Oh,
sleeps, I can look like I'm wearing blush. When in
really?
fact, I have never worn makeup in my life. And after we do the cupping, I do something called a microcurrent. And the inventor of that, Carol Cole, is on Good Morning America right now as we speak in New York City. So the inventor of this amazing microcurrent device that lifts your skin, tones your muscles, is on Good Morning America. So I'm invoking my inner Carol Cole this morning. From there, we start working on the points. We put needles in these muscles to release the 11s. I put about 5 needles in the scalp to lift the forehead, about 5 needles here to release the platysma, a few needles here to open up the
Wow.
lymph. And then I put on an LED light by the company Saluma,
Okay.
and the patient then rests for 30 minutes. So I leave the room then. So they get 30 minutes of red light therapy with fine lines, induces collagen and elastin, and gives immediately a more youthful look. It's a little annoying because it's bright and I haven't quite figured out the right goggles, even though I've done 30 different brands, but the result is worth the annoyance of the bright light. So I come in, I take that off, remove the needles, and then we do cryo tools. So we have these little icy cold tools that I didn't think people would love, but they love them. We follow that up with some hyaluronic acid, a nice moisturizer, a namaste, and they're on their way. So it's pretty magical.
Ooh, I love it.
Thank you.
Now,
And one thing also, Lalita, I wondered if you'd mention about the mouth breathing, because we
Oh,
talked about that.
it was so cute when Deb and I were talking, and I said, I said, and don't even get me started on mouth tape. So, a lot of women my age, women and men, all people, they have this little turkey area here. Okay, what's causing that? When we sleep, and it can start at a very young age, our jaw slackens and our mouth opens, and we don't even know it. So, what I recommend to my patients and others, and you don't have to buy a fancy, expensive mouth tape on a subscription for the rest of your life. I use a tiny piece of medical tape. I put it just over the center of my lips. I go to bed. And here's what's happening. I'm only inhaling and filtering fresh oxygen, which is going to my brain and my body. We're reducing the amount of saliva in the mouth, reducing cavities, bad breath, dry breath, all from a tiny little piece of tape on our lips. It's not uncomfortable. And the very first time I did it, it was noticeable. My brain was clicking when I woke up. And now I won't go a night without it. Okay, coming back to facial acupuncture, within 30 days of mouth taping, you should see a much more defined jawline because you're not sleeping all night with your jaw open. That's my other little thing I love to help people understand.
Wow. This is all new to me. I'm fascinated by this. I've never heard of such a thing. And this is just enlighten me. How long does it last for? And what's like the upkeep to how long do we have to keep doing this for?
Mhm.
Yeah, how does that part work? Thank you.
Yeah. So initially in my training, we are taught to do 10 weekly sessions. And when you do 10 weekly sessions of everything I've just told you about, the results are dramatic. They say they last 3 to 5 years, but I'm only 1 year into it. Um, so in my business, it turned out that I'm not really comfortable asking people for $2,500 up front for 10 visits. So I do them one at a time. And some people can come in once a month. Some people come in more regularly, especially if they have TMJ and I'm getting into the buccal area and their jaw is in alignment and they're so happy. But realistically, it's 10 visits in a row, but I'm not quite there yet. I did do 3 case studies where my 3 friends came for 10 consecutive weeks, and the results were dramatic. And you also get really close to someone when you see them that often and so intimately. It was quite beautiful, actually.
Wow. Oh my
You know,
goodness.
one thing that interested me, Lalita, is that we also will use surgical gloves and work inside the mouth with craniosacral, true,
Hmm.
primarily for TMJ issues, but other
Hmm.
things too. And we can do it ourselves. Like you say, you can take
Oh,
your
yes.
finger and put all the way back as far as you can go
Hmm.
to upper and lower teeth meet. So, and it usually is a little tender on almost everybody. So,
Yes.
feeling better because the upper 3 vertebrae and these bones along here can all
Hmm.
cause TMJ, and TMJ can cause lots of problems, dizziness and
Mm-hmm.
vertigo and all kinds of things. So
Headaches.
I think there's several modalities that do work inside the mouth, and
Hmm.
I always ask people, some people aren't comfortable with it, but a lot of people will give it a try and then teaching them how to do it to themselves, like you said.
Yeah, Deborah, I'm so glad you brought that up because I'm more about empowering people.
Yeah.
So if you come to see me, chances are you're going to leave with a cheap gua sha tool just as a gift.
Wow.
And I'll give them some instruction on what to do. And my patient the other day, she said, "What kind of oil was that in my mouth?" Well, it's just organic coconut oil. And she is tremendous TMJ. She is going in there every day now and she's working those muscles. And Look, we all want someone else to do the work for us. But the truth is
Of
we
course.
need to do the work ourselves. You know, I do the work myself. I get up and do something every single day that helps me. So I love to empower women and men to learn a little routine, 10 minutes a day, and lift yourself up or release your jaw.
Wow.
I also find with, classically craniosacral therapy, you have just a very light touch, or sometimes your hands are even off the body if the person's very
Mhm.
sensitive. But very often I'll say, would you like to feel this? Or maybe I'll teach them a therapeutic yoga exercise to do at home. And that consistency, like you're talking about, makes a huge difference. Just standing at the wall with the heels against the wall and trying to press the shoulders back and the head back, because most people don't realize that they've got a forward head.
Yes.
Just that awareness, or facing a corner and stretching. There's a lot
Mhm.
of things that can complement other therapies. So
And I love how the word consistency.
yeah,
Without consistency, there will be no result. You
yeah.
know, if you want a great fit body, you go to the gym or you go to yoga or you run on the beach almost every day. If you want to help your body to age a little more gracefully, you've got to
Mm-hmm.
put in the work. And if
Yeah.
that means putting on a glove or not in your own mouth and getting in there and moving those muscles around, then do it. Just do it. You'll feel better.
Yeah.
I love it. I love it. All right. Well, we still got 4 more minutes left together, ladies. What else do we want to make sure we cover for today?
I think there's just one thing I'd like to say. Deborah's heard this before. When I first met Deborah 20 years ago, I really hated partner yoga. I'd be in the class and I just want to be by myself, and she'd go, "Okay, we're going to partner up." And my inner voice would go, "Oh, dang it." Well, she connected me with a man, James Knight, and had a 20-year friendship. And
Fabulous
James
guy.
is the founder of Gentle Somatic Yoga.
Ooh,
And why I'm bringing him up, you would love him on your show. So
I may have to contact him. That would be
you
good
you know, you never
for the
know who you're gonna
suggestion.
meet. Yeah.
Yeah. I never knew you didn't like partner yoga.
so funny,
I
right?
know.
So yeah, so I don't really know that I have anything else to say. If there's a question, I'm happy to answer it.
Well, I just love this new modality that I just learned about, and I love with the combination of the two of you. But the power of what we could do, right, with our mind, our body, our
Yeah,
spirit. This is fascinating. And
thank you.
Yes.
what's next for you, ladies? How are we going to connect? What else is happening? Are you coming back in to see her, do another class, or what's happening?
Oh, so Deb is teaching chair yoga, and I actually go to a yoga studio, where I have a membership. So I'm pretty much that's my go-to, which is how I met
Yeah,
her. I've always had a yoga membership my whole life. Um, the interesting thing Deb and I were talking about a little is, I'm hitting my 70th year and she's into hers, is, where do we go?
yeah.
And that could be a whole podcast. Where do
Mhm.
you go from where you're at, where I'm variable here, but you kind of do have to look within and go, okay, I'm not at the beginning or the middle of my life. So, what kind of an impact do I want to make in this next amount of time? So, that's where I'm at now, contemplating what's next. Thank you.
Thank
Yeah.
you so much. And how do we reach out to both of you?
You go ahead first,
Oh,
Lalita.
well, I'm at my healing center is called Oceanside, the town I live in, Healing
Uh-huh.
Center. And if you key that into Instagram, Facebook, any social media, or even the web, you'll find me. And
Perfect.
yeah, reach out. Let me know how I can help.
And I'm Debra, Debra, Hodgen.com, which takes you to Debra Hodgen Wellness. And I also do remote healing. So that's even if you're in Minnesota, you could still get benefit and have a good time with craniosacral.
Yay. Can't wait,
And you
ladies.
can also do remote work. I know Lalita.
Great.
Oh, nope, you got to be in my clinic.
You have to be in
Oh, I
person,
thought
I'm
you
assuming.
said,
Yes.
not for
You
the
know,
facial
yeah.
stuff, but there's some things I know that you can
Oh,
guide.
I discovered about myself, my personality. I'm an in-person person.
Yeah,
I love
it's ideal.
connecting one-on-one. Can't handle crowds, don't like a lot of noise. So I've created this very sacred space where it's very much a ritual and it's just myself and one other person. And that works for me. So again,
Perfect.
knowing what works for you and not trying to fit into somebody else's box, I feel very
Yeah.
free at this time in my life.
Well, we'll have to look for people who are vacationing in Carlsbad and Oceanside then.
There you go. I love that.
Oh my goodness. Well, thank you guys again for being here, for joining us, and exciting
Thank you,
to
Jill.
have you. I'm
Thank you,
away next
Jill.
week. I'm not sure if you're planning on coming back. There might be another host, or I will see you then in 2 weeks. Okay.
Okay, have a
Thank
wonderful
you.
time.
Thank you so much.
Thank
I
you, Debra.
appreciate it.
Thank you, Jill.
Bye.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.